the clouds go gray, the thunder roars and the earth sings. The season's just beginning. The sunlight it hides us the clouds.
Colleagues, as we speak, we have fresh men from Nigeria and also outside Nigeria. We have someone from Ghana, we have from Uganda, we have from Liberia. So without wasting our time, this is the second annual Malnutrition Awareness Week organized by West African Society for Parenteral and Enteral Nutrition, WASPEN.
Let me welcome everybody, ladies and gentlemen, esteemed colleagues, members of the press, partners and friends, and also a board of directors for WASPEN. And I think I recognize one or two people who spoke, the secretariat for WASPEN, and most importantly, again, our WASPEN members who have taken their time to come in this morning. And of course, our new friends who have joined us on this mission on malnutrition. This year, WASPEN stands under a powerful global theme. As you all know, we're here to discuss what we're going to be doing with the Malnutrition Awareness Week. And our theme this year is really powerful. It says, United Against Malnutrition. This theme is championed by WASPEN, which is really our international partner. And WASPEN stands for America's Society of Parenteral and Enteral Nutrition. And what this theme reminds us is that malnutrition is not only a challenge for one nation, for one hospital, or for one organization. It is a shared responsibility requiring collective action. And that's one of the things we're going to be discussing today. Today, we're shining a light on a particularly urgent but often overlooked issue. And what is that? That is hospital malnutrition. Around the world, 1 in 3 patients admitted to the hospital is malnourished. That's powerful, guys. Yet this condition remains under-prioritized in health agendas. In Nigeria and across Africa, the consequences of malnutrition are definitely severe. We look at prolonged recovery, higher cost of care, increased complications, and in some cases, loss of life. You see various studies out there really magnifying these things. At the same time, we cannot really ignore community malnutrition. In Nigeria, over 30% of children are stunted, and about 7% are wasted. These numbers reflect deep-rooted challenges, but they also show why a holistic approach is essential. Malnutrition in the community and malnutrition in the hospitals are two sides of the same coin. Progress on one without the other leaves the circle incomplete. Again, it's very, very important that we need to address both. So that is why WASPEN is working with leading Nigeria institutions to gather updated national data on hospital malnutrition prevalence. Evidence like this will guide us as we push for hospital nutrition to become part of a structured national strategy. Our efforts align with the international campaign that declares that nutrition is a human right. Nutrition is not a privilege for the few. It is the foundation of health, dignity, and recovery for all. By joining Malnutrition Awareness Week, Nigeria and other West African countries add their voices to a growing global movement to make this right a reality. This marks only the second Malnutrition Awareness Week, as you all heard earlier. Last year, 7 institutions across all 6 geopolitical zones participated in this Malnutrition Awareness Week, creating national impact through clinical engagement and media outreach. This year, I'm glad to say that the momentum continues to increase, and we have 17 institutions, maybe even not more, who are officially on board with WASPEN for the first time. Now, for the first time, we have Cameroon and Ghana to join us. And I think I heard somebody from Uganda. So it looks like WASPEN, this message is getting across, and people are beginning to join forces, to address this issue. We are also privileged to welcome 2 esteemed international colleagues from Aspen. One is Dr. Phil Ayers, past president, a pharmacist, and a current Aspen board member. And the other one is Dr. Albert Barokas, who was a board member of Aspen, very well-known physician in the United States, very knowledgeable about nutrition, who will be joining us. Their presence highlights the strength of our partnership with Aspen and affirms West Africa's growing role in the global nutrition care conversation. So let's look at what's going to happen this week. Today, which is September 8th, we're starting with the press conference. Again, I want to welcome you all for joining us. On September 9th and 11th, which is Tuesday, tomorrow, and Thursday, we're going to have expert-led webinars.
My name is Taiwo Jimon. I write for New Telegraph newspaper. While you were making your speech, you talked about, you said nutrition is a human right, not privilege. If you look at the situation we find ourselves in Nigeria, and presently I'm talking about the issue of the economy. There are a lot of people who are in rural area who cannot afford just buying a paracetamol. When such issue came up, when an issue of malnutrition came up in a community, and I mean in a rural area, how do you think, or what do you think that such people who doesn't have the financial strength should do in such situation? Because you said nutrition is a human right, not privilege. That's my question.
And that's a valid question. Nutrition, as I mentioned, is a human right, and it's not a privilege. And I think the points you mentioned, they're real. And that's why I continue to commend what different countries are doing. I know US and some other countries have been supporting, at least Nigeria, and I'm sure some other places, in terms of providing funds to help address these issues of hunger, because it's true, it's not something we can deny, but it's something we need to recognize that we have to do whatever we can to take care of this. And that's why WASPEN, we're an NGO. I'm based here in US, but I'm originally from Nigeria. I'm doing whatever I can as an individual towards this. And that's why I formed that NGO. And I'm also gathering forces, talking to different people to support. Like I get support from the members of my board, from different friends who are here. I think the answer to your question is that we can't turn a deaf ear. We don't look at what's happening. We all, in our own different way, need to continue to do whatever we can to address this. we're doing a lot, at least from what I can read, in Nigeria in terms of hunger, malnutrition in the community. We're doing that. So what WASPEN is saying is the same attention that we are giving with what we have to community malnutrition or nutrition issues, let's also remember that the hospitalized patients also need this type of help.
I am Juliet Alabra. I work with Central Hospital Warri, Delta State, as a pediatric trained nurse and also a midwife.
Welcome, Juliet.
Thank you very much for your intelligent presentation. I have a comment and also a question. Let me start with the comment. As health workers, I think we have a lot of role to play in combating malnutrition, in the sense that we need to increase our health education to the general public, especially taking it to the grassroots. We should educate the public globally on how to use the available foodstuff to prepare adequate diet. Like I tell the people that come to the hospital, you don't need to go and look for chicken before you can give your child protein. Egg is there, crayfish is there, fish is there. There are other ways we can educate them to provide protein for their children. In my department, children emergency, out of 11 children that are admitted, we have about 11 cots or 11 beds in that department. Out of that 11, about 4 children will be diagnosed with protein energy malnutrition, moderate and severe protein energy malnutrition in a week. It's really a burden to me personally, because I see it as, what is really the problem? Yes, we know that the economic situation of Nigeria is tough, but I still think that we still have a lot to do as health workers. Let us intensify our health education in the community, in our religious body, in our environment, our neighborhood. Even those that are coming to the hospital, like those that bring their children for the infant welfare clinic, women that attend antenatal clinic, and those that come to the children outpatient department. We should intensify our health education, teaching them and even practicalizing it if possible on how to prepare adequate diet with our local and available foodstuff. In our environment, we have potato, sweet potato. Use it to prepare vegetable porridge. Your vegetable is there. Vegetable is not too cost. You get crayfish, add your palm oil, spice it with a little things that the child can take. A lot of parents in my neighborhood around this side where I live, they go on preparing noodles for their children. Plain noodles without anything. I am not a fan of noodles. I don't use noodles to bring my children up, but I still educate them. If you must prepare these noodles, at least break egg inside, or you dice vegetables, add a little spoon or half spoon of palm oil. At the end of the day, you see that noodles that you have prepared is adequate for the child to take.
Thank you much, my president, Dr. Teresa Pounds, for this great initiative. I want to keep my comments short because a lot have been said by the last speaker. I actually wanted to add to the answer that Dr. Pounds gave to the journalist that talked about nutrition as a human right. Yes, it's actually the way it is, or the way it ought to be in every climate, that everyone should be able to have access to food at all time. You know, so that is what WASPEN is working towards. And it will surprise you that WASPEN belongs to an organization that is working seriously, to look at the issue of nutrition as human rights in low-income country, in Nigeria. And by appointment by my president, I happen to be in that working group. So what this resonates is that Nigerians, the policymaker, the government, we had to do a lot to make food available for all children at all places. And I also want to commend the present director of nutrition at the Fed for all these conversations that are going on. And she is doing a lot, putting policies to place, encouraging the state government, tracking funds for nutrition in some states. And so I think the conversation is huge. And this year, we are all going to unite against malnutrition, using our different platform and the topics that will be treated. So I want to say that everyone here, the journalists, the health workers, we really have a lot to do to ensure that this elephant in the cupboard, is brought out and dealt with.
So I just want to ask a question briefly about the theme for this year, United Against Malnutrition. Could you please tell us why the choice for this theme, and why is it coming from WASPEN? And
Okay.
also, what is WASPEN doing differently this year to ensure that this campaign gets to the group so that they too can benefit from it?
Those are all good questions. First of all, WASPEN is partnering with WASPEN. I'm an active member of WASPEN, American Society of Parental and Enteral Nutrition. So together, WASPEN is part of what WASPEN is doing to come up with the theme for every year. And this year, that theme was chosen, and that was really timely for me meaning WASPEN, because I'm at the point now that WASPEN has been in Nigeria working on this issue of malnutrition for the past going to 6 years now. So it's time now for WASPEN to start expanding to other West African countries to start with. And that's why you see representatives from Ghana, from Cameroon, I also had somebody from Uganda. So, and in order to really take care of this issue, you can't do it alone. It has to be a team effort. So that's why that theme, United Against Malnutrition, I think it really makes a lot of sense. United for one common goal, which is malnutrition. And like I was saying, malnutrition in the hospital. Again, I'm not saying that malnutrition in the community, as you all have heard me say this morning, is not important. It is. Those two have to go hand in hand. Now, so that is why that theme was chosen, and it was collectively done, WASPEN and WASPEN, because we're all working together. All right. What has WASPEN done differently from what we did last year? Again, the answer to that is this year, WASPEN is focusing on expanding, having chapters in various West African countries. You heard somebody from Ghana. We're working on the logistics. Somebody from Cameroon. So our goal is, by God's grace, hopefully by early part of next year, WASPEN will have chapters in at least 3 West African countries. That's what WASPEN is doing differently.
Thank you very much for a wonderful presentation that you have made. And I'm happy that you noted that there is partnership between the Ministry of Health and state government.
Yes.
My question is this, ma. How solid is this partnership? Are there things they are put in place, or the partnership is just verbal? Because I know that clinical malnutrition is one of is a very challenging thing in the country right now, because people cannot basically afford it. And I might be wrong, but I know people might have passed on because of malnutrition in the hospitals. They can't eat solid food, they can't swallow, they can't, and instead of devising other means of feeding such people, they are left on their own. So is WASPEN working with pharmaceutical companies in Nigeria and governments in Nigeria, particularly the Ministry of Health, to find a way to make this food needed, particularly by sick people, to get it at a subsidized rate, because the financial implication of nutrition in the hospital, particularly for people who cannot feed themselves, it's very challenging. What roles, particularly now that everybody is partnering, I hope it's not just WASPEN that is pushing it down their throat and they're just saying, okay, we agree, why they are not putting anything on the table, particularly the Ministry of Health, man.
Okay. I think I really appreciate those questions. It's very, very, these are good questions. And for transparency's sake, I will say that the partnership that we have with Ministry of Health, I've been very, very impressed with the support that they're giving. It's not just verbal. Of course, we have the MOU, Memorandum of Understanding. I will have to say that this year at our conference in Abuja, the director of nutrition in the Ministry of Health, it was so interesting while we were doing the health work and some questions about clinical nutrition and what WASPEN is doing was asked. I was so impressed with the answer she gave that when she finished talking and they asked me what I think, I said, well, I don't have anything else to say. She said it all. Why am I saying this? I'm saying this to let you know that I think she really has a clear understanding of what WASPEN's message is and what WASPEN goal is. The fact that she's even going to be one of the speakers for the webinar we're having this week shows you again how actively involved they are and want to continue to be. I mentioned earlier that one of the institutions, LUT, where we had the conference last year, they have their nutrition steering committee, and it's a multidisciplinary group. Ministry of Health is wanting WASPEN to make sure that anything that is happening in these institutions to carry them along. In other words, to work with us to ensure that eventually that they can give the support. So in answer to your question, I'm very, very impressed with the support we get. And I think it's going to continue to move in the right direction. Now, with pharmaceutical company, what you have described, and let me break it down very simple. Patients who are in the hospital, who are really sick, some of them coming for maybe they call it GI, but I'm going to break it down to the level, stomach surgeries. Some are cancer patients. Some have surgeries, and then something happened to their stomach, and they cannot eat the normal way, the way me and you or anybody else eat. The only way these people can get their nutrition is through IV, parenteral nutrition. And you are correct. A lot of these products are very expensive. They cannot afford it. WASPEN recognized this very quickly, that even when we identify these patients that are malnourished and we know they need parenteral nutrition, that they cannot afford the product. So what did WASPEN do? So we are partnering with one of the biggest pharmaceutical companies in Nigeria. We've been working with them for the past going to 2 years. And what we're doing is, of course, I have the clinical knowledge, is to come up to eventually have it whereby these products will be manufactured in Nigeria. If they are manufactured in Nigeria, which we know by the grace of God is going to happen very soon, it will be readily available, and it will be more affordable. So that's one thing we're doing. The second thing that WASPEN has done, through a partnership with Aspen, we have made it possible whereby a company, if a big company in Brazil is going to be working with another company here in Nigeria, and that company is going to be like the major distributor for the enteral nutrition products.
My name is Gerald Konyene. I'm the editor of the Heather News at Front Page Africa. Is one of the leading newspapers in Liberia. Thank you. The problem of malnutrition is a major problem in the region. I was just reading the data for Liberia, and I saw that 1 in 3 children suffers from stunting and is stunted, and about 6% of the population, the children population, suffer from malnutrition. So WASPEN, I want to know whether it is limited to Nigeria, or you are all over West Africa, and if yes, is my country Liberia a member of WASPEN? Are you working with the Ministry of Health, or do you have membership in Liberia?
Very good question. And this is why why we invited some West African countries to join us, because WASPEN is well established in Nigeria. We now want to do the same thing in other African countries. So Liberia, yes, we're looking for champions that will help us get into the country. Already we have a champion identified in Ghana. We have a champion identified in Cameroon. So we need a champion in Liberia, so that the same thing that we're doing in Nigeria, we should do it in those countries. So WASPEN's plan is to have chapters in these countries. But we had to start in Nigeria first, get things established. And that's why when that question was asked, what is WASPEN going to be doing differently, this year than that? And that one of the things we're doing different is now wanting to expand, to do the same thing that we did in Nigeria, to start doing it in other West African countries. So if you know anybody, or if you want to be the champion, please chat me up after this. But yes, like I said, we already have 2 champions, and one of them, somebody in Ghana and somebody in Cameroon, and we want to expand to other countries. So I hope I answered your question.
Yeah, Mr. Soje on the line. Thank you, and I say congratulations to everyone for the commencement of World Malnutrition Week. As my president has highlighted, WASPEN is focused on hospital malnutrition and as well as community malnutrition. And you know that when patients are admitted into the hospital, most of them come in with malnutrition, but we address the primary issue that brought the patient, ignoring the malnutrition. And we know that a malnourished patient will stay longer in the hospital, will be exposed to hospital-acquired infection, the cost effectiveness and all that will be there. So these will be addressed when we start assessing and screening patients for malnutrition as they come in and during their stay in the hospital. We see some patients, because of their condition, they are on NIP per aura. They don't eat through the mouth. They are maybe for some days or weeks. And just intravenous infusion will not sustain such a patient. In that situation, oral enteral nutrition will come in, or parenteral, depending on the severity of the malnutrition. And WASPEN is a multidisciplinary society comprising the physicians who are the lead of the team. The dietitians are there, the nurses, the pharmacists, the lab scientists who will do the results. They carry out the test to assess the state of malnutrition in this patient. So we are asking all team members for intensive collaboration. And the malnutrition screening and assessment form is being developed by the Nutrition Steering Committee of LUTH. And I think it has been adopted by LUTH management. Over time, I think it will go national so that other hospitals will key into the malnutrition screening form, assessment and screening form that we use to assess the nutritional status of every patient that comes to our hospitals. Then I will equally advocate that we do in our respective communities and institutions, let us do community outreach to educate people about malnutrition. As one of our colleagues, a pediatric nurse, spoke earlier, that it's not the quantity, it's the combination of food that matters. You don't have to go for very expensive food, but the little you have in your community, you combine it well, and the cooking method, those will help us to avert malnutrition at community level.
This from one of us, Onome, to Dr. Teresa Pounds.
Yes.
She's asking, from the last press conference to date,
Right.
has there been any favorable response from the federal government in supporting the cause to address clinical malnutrition in Nigeria?
That's a very good question and a direct one. Right now, nothing yet in terms of the cost, but some ideas have been thrown around. Cost, as we all know, is a very touchy situation right now. US is not, everybody's pulling out in terms of support, but WASPEN is hopeful that with some of these collaborations, not only with the Ministry of Health that we have, that maybe with the pharmaceutical company and some, that we will continue, hopefully start getting support for what we do. Right now, because this is something that I'm very, very passionate about, it's something that means a lot to me. I'm doing a lot through whatever I can on my own. And I'm also fortunate to have people that are supporting me, friends that are supporting me whichever way they can. And even some of the pharmaceutical companies, they're supporting. So right now, like I said, nothing tangible in terms of cost, but there are some things that we're working on that hopefully will take care of that.
Another question from a colleague from Lagos Traffic Radio. Good morning, ma. What's the take-home message for governments, medical experts, and the community for this 2025 Malnutrition Awareness Week?
The take-home message is, number one, that this is not something, it's not a fight for one person. All right. I think the president, like I mentioned, of the Federal Republic of Nigeria, the Federal Ministry of Health, and key nutrition-focused organizations, we all need to join hands together to really address this issue. Especially, the main thing I really want to drive home is, I think community malnutrition, people have caught on to it. I want people to understand that malnutrition in the hospital exists. I'm not sure whether that message is loud and clear yet, and people are understanding that it is important for us to also recognize that malnutrition in the hospital exists. And I just want to also say that in the United States, years ago in the 70s, the same thing we're seeing now happened then. And there was a very popular physician that actually wrote an article that said, guys, we have a skeleton in the hospital closet. And what he was calling that skeleton, what he meant by that skeleton was malnutrition. And I think one of our speakers doing a webinar is also going to talk about it. So that is why this malnutrition awareness activities that we're doing is very important. That is why institutions have to have their own special activities that they're going to do in their own particular to be able to continue to drive home that message. So that is my message. My message to the Federal Ministry of Health, to the President, is the same attention and support that they're giving, that we're beginning to see that they're giving for community malnutrition. We need to start doing that for the hospital. For example, like if you go into some of the hospitals, manpower, that you don't have enough dietitians. And dietitians are important when you're talking about really identifying these patients. They support, manpower support, human resources, the physicians, pharmacists, dietitians working together, that team approach in the hospital when it comes to taking care of patients who are malnourished is also very key. So I think that's my message.
How can communities support towards bridging existing gaps? That is from one of our colleagues, I think from this day, newspaper.
You all have started it already. Coming to this program this morning is one step. That is how you're learning what the message is. So the next thing is help pass on that message. Spread the word. Educate as many people. Tell them what's happening. Tell them about this subject I keep talking about, hospital malnutrition. Talk to them about what you've heard. It's not just one person's job. Educate. If you get to a point whereby you feel like, you're trying to educate and they need more information, you will have my information. Contact WASPEN. We need to spread the word. Spread the word. Talk about implications of hospital malnutrition. I know how many friends that I have who are here with me here in the US, who have relatives that went into the hospital for a surgical procedure. And they call me when it's almost too late and say, my relative has been in the hospital, they had surgery, their wound is not opening, it's not healing, their wound opened up, or they're in the ICU, they can't get them off from the ventilator. They're losing weight. A couple have even died.
Thank you very much, Ma, for your well-articulated presentation.
Thank you.
I'm Ijoma from College of Nursing Sciences from Plateau State.
Okay.
So I want to suggest that to effectively manage this clinical malnutrition, every hospitalized patient should be strictly placed on hospital diets until recovery and discharge, so that such factors as food quality, food hygiene, and feeding habits will be closely monitored. And the food should be subsidized closely, like for patients with low socioeconomic status. Because you find out that once a patient is admitted and the caregiver is asked to go prepare food and bring for the patient, the caregiver simply goes home, puts together whatever they find, and then brings to the hospital, not considering the nutritional benefits of the food ingredients used. So the food, in turn, either worsens the patient's condition or ends up having little or no nutritional value. So I think we should work towards having hospitalized patients eat from the hospital until recovery. Thank you, ma'am.
I just want to reiterate on what Dr. Pounds said, and somebody asked about the team united against malnutrition. So WASPEN is a part of the international working group, and like Dr. Pounds said during our presentation, this has become an international campaign, and WASPEN has taken the baton to drive it here in West Africa. So it is a collective effort, like Dr. Pounds mentioned, and last year with our malnutrition awareness week, we try to be innovative in utilizing the media to raise this awareness. And the malnutrition awareness week we all have it is just to create a voice for the malnutrition, because a lot of people are not well educated. Many of the policymakers are not well educated about this issue of hospital malnutrition. And that's why we're trying to increase our voice towards this. And with time, it will turn into a policy. And, it's policy that we actually need to be able to have effective impact in our society and in various institutions. And it's already a big win for WASPEN to be able to have over 17 official institution partner, and this is more than 17 voices from various institutions saying the same thing, that malnutrition in the hospital does really exist. So it's because in the right direction, and we're already doing something about it. And also the partnership with the Federal Ministry of Health with the long-term goal of having this malnutrition awareness week adopted as a national awareness campaign. And this is one of the works in the pipeline and the collaboration we have with the Ministry of Health. And we're working with their guidance to have this fully adopted in Nigeria, and also other West African countries as you can see, are present on this one. So this malnutrition awareness week that we have initiative that WASPEN is pushing forward is for there to be a continued addressing the issue of malnutrition in in hospitals and our community. And we hope to have better turnout next year, better than we had this year. And the policy report that this is going to drive, we hope to be able to push these policymakers for right policy and inclusion of nutrition in insurance and all other beneficiary policies for patients in Nigeria. So I just wanted to reiterate this and add that this is what WASPEN is currently doing, and this is the future, a long-term goal of WASPEN as they address malnutrition.
Since malnutrition, hospital malnutrition has to do with treatment, patient illnesses, and how these interact, I would like to ask if Professor Pounds can speak to the relationship between out-of-pocket spending for health and then the impact on patient nutrition, and what the increased call for expanding the net of the insurance coverage for more Nigerians. How can this help to impact hospital malnutrition? If patients can spend less on their drugs and other needs in the hospital, can they have some more money to address the aspect of their required nutrition while being placed on treatment in the hospital?
That's a loaded question, and it's a question I appreciate. And I'll be honest with you to say that this insurance situation in Nigeria is something that I'm still studying to see what can be done, because here in US it's simple. You pay for your insurance. If you get sick and you're admitted to the hospital, everything is taken care of, from your insurance. It includes everything. It includes your food. So that question, that recommendation that was made by the young lady saying that hospitalized patients should have their nutrition from the hospital, here in US is done already. So nutrition, your medication, your supplies, everything is included. So I'm finding out as I continue to work closely with what's happening in Nigeria that it's not the case. patients have to buy everything. They have to bring in their food from home. They have to buy their supplies and all that. So I don't. Let me just say it is on my list of things to do. But I felt like I needed to at least address that product availability first. And that product availability means having the product manufactured in Nigeria.
Dr. Teresa Isichepong,
Yes.
you have just moved to other West African countries.
Yes.
And before now, you had the message for the President of the Federal Republic of Nigeria.
Yes.
What is your message for other presidents of West African countries?
The message I have is the same message I have for the President of Nigeria. Because I'm sure the same thing that is happening in Nigeria in terms of awareness of malnutrition in the hospital malnutrition, I'm pretty sure it's happening the same in other West African countries. So it's the same message. And that's why moving to other West African countries makes a lot of sense, starting with Nigeria, going to others. So the presidents need to be aware, need to get educated that yes, hospital malnutrition exists. They need to make it a priority, just like we've made community malnutrition a priority, and they need to give it the resources. Resources can be human resources, support. And I'm sure the same issues, the same gaps we're seeing in Nigeria is the same. It's going to be the same in other West African countries. Gaps in availability of data, gaps in products, gaps in education, gaps in team, the different disciplines working together to address provision of specialized nutrition support. So it's the same message. And that's why moving to other West African countries makes sense. Together, we have to work together to make this, to take care of this problem that we have.
I just want to raise a little concern. I want to appreciate WASPEN for what they are doing and trying to see that malnutrition is brought to either zero level or to some certain percentage at least. So, but I just want to plead with Dr. Pounds and also WASPEN. I think another way that we can also achieve this malnutrition awareness or reducing malnutrition, maybe if WASPEN can, in their collaboration with the Ministry of Health, help by maybe reminding, even though Ministry of Health have been trying, but in most cases where I look at some of this gap is that we have thousands of dietitians that are graduates. We even have technicians that are also graduates, but yet to be involved or maybe employed. Now, another thing is that sometimes you will see training that has to do with nutrition, but when you go to such trainings, you see people that are not even in the provision of nutrition. Sometimes you even see people as admins. You will see people that are not health related. They are the ones in that training. Now, my fear here is that when you train people that are not in a particular field, and at the end of the day, you want to get results, I don't think you will end up having that result.
Thank you so much. This is a very, very awesome presentation. Thank you. Mine is just like a suggestion. So I think there should be an introduction of a structured nutrition screening and intervention pathways in so many hospitals, because there are so many hospitals that don't even check the nutritional status of the patient. They just went directly in treating the patient. Those identified at risk should be referred immediately to a dietitian for an individualized nutrition support. There is this oral, enteral, and also parenteral as needed. And then also to strengthen this, We can also integrate a digital tracking of patient nutrition status into hospital records, ensuring continuity of care and also reducing the missed cases. So in these cases, I think there should be a capacity building for health workers on nutrition screening, and also there should be a strong collaboration between dietitian, physicians, and other hospital staff, because in so many cases, you might see maybe some doctors or other health workers, they don't even work, they don't carry the dietitians along. They just went on their own to suggest everything. In fact, at times you can even see an attendant trying to give a patient a nutritional counseling on what to eat and what not to. So please, I think this should be taken into consideration also.
Thank you very much, Dr. Pounds, for
you.
your welcoming remarks and very enlightening. I've been with WASPEN. Last year, we were engaged in media chat in Plateau State with NARED. So we're glad. I'm from the academia, actually.
Okay, yeah, okay.
Yes. And so thank you for your comment on the issue of availability, accessibility, affordability. And I think the fourth one is sustainability.
Yes.
Yes, when in the hospitals, like somebody mentioned, that there should be a planned diet for patients. Yes, in the hospital, we'll be able to identify the deficiencies, the nutrient deficiencies in such individuals. But the issue also is when they leave the hospitals, for full recovery and for sustained nutrition and health, I think there should be a follow-up like somebody suggested. But again, the dietitian should be able to know what is available to the patient after leaving hospital, what is affordable to the patient, and whether the patient can access those food groups that can be combined. So education awareness is very important. When patients leave the hospital, they should be well informed on what they need to combine in their communities so that they can have a sustained nutrition recovery. And I think we should build in such plans or strategies into our programs. Already we know what the foods are and what they contain. And different communities have different food groups and food availabilities and affordability. So we should be able to be conversant with such and give them the right advice, the right information, and the right combination they need to make when they get back home for a sustained.
So I just want to appreciate WASPEN of their good work, and also our institution is a part of partnership with them. And I want to key into with what Mrs. Grace Stevens said. It's very, very important, and I know WASPEN can help us to ensure that our institutions have a lot of dietitians to support. Because I know with WASPEN collaboration with us here, we have been doing a great job here. So I just want to appreciate them. I just want to tell them to continue with the good work they've done, the Federal Ministry of Health, and also.
This question is coming to you, Dr. Teresa Isichi Pounds. Good morning, ma. Thank you for the incredible presentation. My suggestion is that there should be a dietitian intervention too for inpatients to avoid hospital malnutrition. Dietitian nutritionists should always carry along on every assessment.
You know, I stress that multidisciplinary team approach. And I think there's a role for every discipline. But when it comes to the assessment, I think the dietitians, they play a strong and key role. And when it comes to, counseling and talking to them about the diet and all that. So dietitians have to be recognized. And that's one of the things that WASPEN will continue to work with the key stakeholders. And we need enough dietitians. The way it should be when patients get admitted, of course, the nurses are involved heavily with the screening of the patients, the physicians are. So that's probably where the nutrition screening will happen. When patients are recognized as either being prone to be malnourished or malnourished, the dietitians are the ones that are very, should really take over in terms of the nutrition assessment, making that diagnosis for patient being malnourished, then giving recommendations, and then the physicians can then ensure that that happens. And when it comes to monitoring of the patients, then all key disciplines are involved. Obviously, the pharmacist also play a key role. If the patient is a candidate for parenteral nutrition and the formulation and all that, the pharmacist, definitely is the one that supports the team. So it is a team approach, and each team member has a clear role that they play.
Clouds make way for the pouring of my blessings. I will not be afraid.